Staying with the confirmation of the coronavirus outbreak, we're now being joined on News Track by Dr. Bisola Adebayo, a consultant public health physician. Thank you for joining us, Doctor. Now, with the news out there, what symptoms should Nigerians be looking out for?
So the symptoms of coronavirus are generally symptoms of a respiratory disease. Initially, it happens like in pneumonia. The person might have fever, a cough, a catarrh. You can have symptoms of malaria, feeling generally unwell, body aches and things like that. Because you find out that the coronavirus is still the same family of the virus that causes the common cold. But you have different viruses in that family. So if you're having fever, a cold, and then you'll be having, cough, and there's history of exposure, because we don't want people to panic. We want to spread right information. History of exposure, maybe you've traveled to a country where they have confirmed cases of coronavirus, or you've been exposed to somebody that might have been exposed to coronavirus, because we don't want everybody that just has cold and catarrh, to think that they have the disease.
Okay, Dr. Adebayo, we understand that there is an emergency operations center that's already activated and a lot of activities are going on there. And indeed, you talked about not wanting to spread panic in the country. But let's see if we can assure Nigerians about that there's work and everything is on point. What kind of activities are going on at the operations center?
So I'm sure you know that the Honorable Commissioner, he's very, he gives information as it happens. You find that his Twitter account is very active. And I would like you to know Lagos State had already even started the Emergency Operations Center even before they had a confirmed case, because preparedness is as important, as action in the face of the outbreak. So these things have started before. And now we're just switching up to a higher gear of operation. So things have been going on. For example, you find out that it's already been released that we had suspects that had been tested negative, apart from this present one that is positive. So they've tested suspects. Contact tracing has been going on. And Lagos State even has a call center, because there's one thing, we've been following up contacts from high-risk countries. And then we've been testing people that are suspects. And in addition, there's a call center where rumors are addressed. So if there's any rumor of, any suspected case, it goes to the relevant local government and it's addressed. Somebody follows up. So these things have been happening, already behind the scenes. And now Lagos State is going to work together with National Center and Nigerian Center for Disease Control to make sure that, we limit the spread, of the disease. But one thing I would also want to mention is that please, you find that a lot of people are stigmatizing people. We don't need to do that. It's not everybody, you don't just see it on the face. So people should beware of stigmatizing people, thinking, they may have they might have the virus or things like that. And the good thing also is that you find out that for coronavirus, mortality rates, they are lower than even for Ebola or for SARS. So for now, it's basically between 2 to 3%, although higher in people that are elderly. So it's something that if people suspect they have the disease, the idea is to present early, before onset of complications, because a lot of people still recover. So I want to assure us a lot is going on behind the scenes, and I'm sure that we're going to get addresses from the relevant authorities in terms of this as we go on today. Thank you.
I just need you to confirm this. Is the coronavirus airborne?
That's a good question. So for now, from what we know, it's not airborne. It's spread by droplets. So for example, a disease that is airborne, you have things like chickenpox and measles. So you might have maybe somebody that had measles was in the room and has left. Those particles are still suspended in air and someone might get it, but coronavirus is not like that. You have to have so it's carried in the droplets. So when a person coughs, droplets are larger, the particles are larger than for airborne, particles. So it drops. That's why they say maintain a distance of 1.5 meters or 5 feet. So it drops, on a surface. So what happens is that it's spread by droplets, and then people can still get it if there's a contaminated, surface. That's why we're saying, wash your hands, sanitize, and things like that. So from what we know right now, it's not airborne. It's spread by droplets. So droplets are carried, when you cough, when you sneeze, but it drops. It's larger than that, so it doesn't travel far distances. So it drops like within 1.5 meters around, so it can drop on a surface or things like that. So it's for what we know now, it's not airborne.
All right. Thank you very much, Dr. Bisola Adebayo is a consultant public health physician. Thank you for sharing today with us.